Carly Kunzman, MD, and I lived in practice for many, many years in a Lyme hotbelt in Pennsylvania. So I lived with these deer ticks and treated so many cases that they were too numerous to count. So I'm about as an expert as it's going to get on the topic of Lyme disease. And this is the time of year that we have to be mindful about it. I will keep you away from those critters and teach you why and where these infections come from and how to treat them. So as integrative as I am, there are no real reliable treatments to date other than the proper antibiotics at the proper time. In some states, the cases have tripled over the past 10 years, and we used to think it was only in the Northeast, where I come from, first discovered in Lyme, Connecticut. Weeks ago, I had a lab-proven case from a native in Colorado who had no travel history outside of the state. So let's get to it. The white-footed, or what we used to call the field mouse, is actually what carries the disease of Borrelia burgdorferi, which is a bacteria. So there are the adult deer ticks, which mostly feed on the white-tailed deer. They will drop off and lay their eggs on the forest floor. And the next year, those eggs will hatch into larvae. And at that point, they're generally still not infected by the bacteria that causes Lyme disease. So those larvae get infected when they feed on the animal that carries the bacteria, which is those white-footed mice or field mice. Those larvae will then molt and become infected nymphs. So the field mice will feed and love acorns, which comes from the oak trees. So there are high amounts in the decidual forests and where there are high amounts of the field mice who could actually pick up these larvae. The deer ticks themselves need a brush border in the area of these forests. So the field mouse will live in these grassy and wooded areas and become a host for those eggs and larvae that the deer tick will lay on the ground. So then again, those larvae will get infected and yield the nymph stage, which is the stage that is the highest infected with the Lyme disease. So the deer are low to the ground, and the deer tick is also called a back-legged tick, which will make some sense why the back-legged nature of those nymph stage can actually get to the deer and wind up attaching to the legs of the deer and migrate up the deer. And again, let me explain why they are actually found in the brush-bordered area of the woods, since the shade can help keep moisture all day long. Those deer ticks, or back-legged ticks, have a certain exoskeleton that actually needs a cool mist to optimally survive. And the dog ticks and wood ticks are completely different. So the ways to manage and remove a tick, if it is a dog tick or a wood tick, is different than trying to remove a deer tick. You'll never see these ticks in an open grassy area because that would get bright sunlight, which would dry out the area and dry those exoskeletons so they could not breathe. And this again is why there is such a high preponderance of the disease in decidual forests that will create grasses and shaded environments. So the highest preponderance is in Maine and the Northeast sector of the United States. And I am only going to speak of the United States at this point, but there are cases that are in Canada, and we may or may not find them in other countries, but I will speak to what I know. So they're actually high in Wisconsin, Again, Canada, as I said, and then down the coastal section of the Northeast, even into Florida. And then there's a big sector out on the California coast, and a little less prominent in the drier sections of the United States, because in the drier sectors, the 85% humidity that is needed for the ticks to survive just doesn't exist. Now, global warming is changing this and these stats and the prevalence, and this is a portion of why we are increasing our cases. Now, no state has 0 cases. So let me repeat that. No case has 0 cases. We also have people who will migrate back and forth to different states through travel. And very specifically, there are birds of migration that cover a lot of miles and territory. So the deer are actually immune to Borrelia burgdorferi, which are the bacteria that initially are infecting the tick. But so are the field mice. The field mice are immune to this bacteria. I have seen deer that when they're killed, they have thousands of these ticks that are on their pelts and in their hair. And as soon as the heat and the blood circulation goes down in the deer, those deer ticks slough right off of those pelts. So as we go into a wooded environment and deer have passed through these grasses, as do we, they pick up the infected tick, which is typically in the nymph stage. We will fall in victim to the infection since we are not immune to it. Now, those nymphs are so small that they may only be up to 2 millimeters, if that, and they are flesh colored. Especially if they are in a hairline of us, we may miss seeing them or feeling them. Again, in the West, with fewer grasses and fewer moist brush borders, we will have fewer opportunities for those ticks to exist. Don't forget, to survive, these immature ticks need mice, squirrels, and birds, but the adults will need the deer. They cannot survive on their own, just openly on an open surface for a long period of time. Now, the immature deer ticks will need a warm and humid area, but some of those Arctic areas that we thought would never become warm or moist, actually with global warming are coming, and the adult ticks wind up being hardy in the colder months. So far, Lyme disease has not been proven to be spread person to person. Lyme disease, if you are pregnant, could cross the placenta as it is a bacteria, but if the mom is treated, there are no negative effects on the fetus. There is no Lyme in breast milk. Remember, it's a bacteria. It hasn't seen any blood-to-blood transmission. You can't get it by eating squirrel meat or the deer meat. It is not transmitted through the air, water, or bites of other bugs. But pets can get it, since ticks can migrate up the pelts of dogs and cats. So I'm going to explain a typical patient that I see, and again, I have seen so many cases in so many varied phases that they are too numerous to count. So classically, we are talking about the spring or summer months, outdoors hiking, typically, and the patient will present to me with joint aches, fevers, possibly sick to the stomach, feeling like the flu, And in many cases, we have a large bullseye rash. And this is called erythema migrans. And sometimes they have multiple target lesions, which is what the bullseye rash is. Commonly, there are headaches. Now, sometimes there are Bell's palsy, which is a facial droop, or tremors or neurologic complications. And this is Lyme until proven otherwise. And the tricky part about this is testing is most accurate when it is about 2.5 to 3 weeks after the infected bite. And this is when the Western blot or the antibody testing would fully manifest. So treatment must start if there is a high index of suspicion in the case. Now, luckily, this bacteria is susceptible to many antibiotics, and one of the most common ones is doxycycline. But I must remind people, you can get reinfected over and over and over again because it is a bacteria and it is not a virus, and we do not keep our immunity to it. So most practitioners, I included, will have a tendency to treat and then use the testing to confirm. Now, of course, if it is a low index of suspicion, you could wait until the testing. Now, that tick, particularly the nymph stage, needs to be embedded at least 24 to 48 hours to even be at risk, and not all ticks are infected. And again, since deer ticks need moisture, the best way to remove them, bar none, is to get out a hairdryer, dry it off, then take your tweezers to release those very hard metallic-like clasps that they have at their mouths near the salivary glands to get it out. Now, dogs can get immunized against Lyme disease because there is a vaccination for the dogs. But years ago, when we had that same vaccination for people, there was this potential complication which is hard to prove or disprove, but it was a complementary cascade, which is a very specific immunological term, that created an immunity in the jointed surfaces and potentially was causing some joint destruction, causing a lasting arthropathy. So it was removed from the market. So the way the immunization works for the pets, particularly the dogs, is the antibodies that the dogs receive will actually cure those ticks when they are embedded in the skin and the pelt. And there happens to be more cases of Lyme disease in dogs than there are people because of that back-legged nature of the ticks being in the brush borders and grasses that can easily migrate up the legs of the dogs and embed. And of course, the dogs are not wearing jeans or outerwear. So when you're outside, tick spray when you're camping and covering with clothes and socks is mandatory to help try to prevent it, but it may not be foolproof. DEET is one of the main chemicals that's used in the tick spray. Again, not 100% foolproof. So what we often recommend in your environment is to try to mouse-proof and to try to deer-proof your gardens. So you want to keep the two main carriers away from your living environment. Now, some people believe in citronella, eucalyptus, certain oils of lavender, juniper, oregano, and clove, and they are somewhat comparable to DEET, but again, there seems to be no topical that is foolproof if these ticks want to get to your skin and embed into the skin. Now, if you're going to make some of these repellents, you're going to want to combine them with some water and alcohol, shake and apply. But again, clothing would be the number one repellent. Also, trim those grasses near your home because these ticks live longer in those brush borders on those grasses. In the summer and spring months, you must do tick checks on a daily basis. And that means fully naked and assessing your skin, your partner's skin, your children's skin to make sure there are no ticks embedded. Now, I want to make a little comment about chronic Lyme disease. Now, the bacteria cannot really hide to the point where somebody has been on antibiotics for the appropriate amount of time. And it would not be advisable ever to be on antibiotics for a lifetime because this bacteria is so susceptible when caught early, and it doesn't hide out in certain portions of the body. However, you can have a post-infectious syndrome or a post-infectious inflammation where if there has been joint destruction, if there has been inflammation of a nervous system or breakdown of a facial nerve or, God forbid, a brain involvement with an encephalitis, that may have its lasting effects if the infection was caught late. So we need to be very cautious about our terminology. And because it is a bacteria, you can get reinfected over and over and over again. And I liken this to strep throat. Many of us are familiar that strep bacteria is a common pathogen. You take an antibiotic, it goes away, but you can get reinfected because we do not keep our immunity against a lot of bacteria. Testing is quite sensitive, and please know that we aim for cures and great outcomes, so please find treatment with us physicians. Be careful of the victimization from non-medical practitioners who are making you spend thousands and thousands of dollars preying on chronic Lyme treatments and chronic antibiotic therapy. Be mindful of infection versus sequelae and leftover trauma to the joints and the nerves from the infection. The post-infectious symptoms are a whole other breed, and they may respond to some rehabilitative techniques that may be integrative and in varied scopes of medicine, but that's beyond the scope of today's discussion. We must be safe this summer. Please cover up, please check for your ticks, find us if you are feeling ill. I do ask that you would leave some comments below about your experiences with Lyme disease and how that went for you. A reminder that there are cases in every single state. So for the practitioners, be mindful. For you patients, be mindful. I would ask that you share this to anybody who is in a high Lyme area who may need to know this information, or who has had the infection, or who suspects the infection. I will entertain any questions you may have. Subscribe to my channel below. And until we meet again, be well.